Thank you very much. It's a real honor to be talking here today. So I'm going to be talking about something that's not directly related to my PhD, but something I hope to relate to it at some point. Talking about aperiodic dynamics in EEG, specifically in epilepsy to start with. So I'm a clinical neurophysiologist, so if I'm looking at EEG, it typically looks like something like this, where there's only a few things that I can really infer by looking at it, and I'm looking at the morphology, and I'm looking at the frequencies. So if I was to focus in on a specific lead of EEG, all I can really comment on is how many of these waves are occurring in a given second, and that's how I estimate the frequency. But we know, because we've seen these power spectrums when we do a Fourier transform, that's not the whole story in the frequency domain. When I talk about an alpha rhythm and I say that there's a 10 hertz frequency, I'm only focusing on this little Gaussian looking hump here. That leaves all of this other stuff. And that's what's referred to as aperiodic activity. And that typically follows it follows the shape of the power going with the offset times the frequency to the power of the minus exponent. Some work has been looking at this and what this aperiodic activity represents. This work by Gao modeled separately the excitatory and inhibitory firing. If we fit some straight lines, this log-log plot, we can see that the excitatory firing, which is the top line, has a lower exponent because it's a less steep line, but it's also got a higher offset. So the thing which we're assuming for a lot of this is that the excitatory inhibitory ratio affects the exponent and the offset. I don't imagine anyone was there last week, but last week I presented some work at the European Congress of Clinical Neurophysiology, and we were looking at deep electrodes implanted in pediatric brain tissue, and we were doing cortical evoked potentials. And what I was able to show was that the pre-stimulation aperiodic characteristics predicted the evoked potentials and also the induced responses. That plots the correlation at a given time and frequency between the pre-stimulus aperiodic exponent, so that's the K in the equation, and the power of that time frequency. So the questions I wanted to ask for this bit of work were, if aperiodic features seem to relate to the excitatory and inhibitory ratios, do they change before a seizure onset? And are they different in the regions of the brain which express epileptic changes versus areas that don't? So I looked at a retrospective sample of 248 patients capturing 2,840 seizures. This is from the Temple University data set. And this has expert labeled seizures where they actually label the onset and offset for each seizure in each lead. So it's quite granular. I then selected up to 100 10-second pre-ictal, ictal, and post-ictal windows. So pre-ictal means before the seizure, ictal means during the seizure, and post-ictal means after the seizure. And I had up to 100 depending on the data availability. I extracted these power spectrums using Welch's method and fitted these parameters. The other thing I did was, obviously seizures vary in length, so I time warped them so that I could say that all the seizures lasted an arbitrary duration of 100 arbitrary units. So this is the equation, just a reminder. So it's the offset times the frequency to the minus exponent. This is the distribution of those parameters that we got. And for both of them, there's clear bimodal distribution. On the left, we've got the exponents. On the right, we've got the offsets. Plotting these against each other and splitting this into leads that have epileptic seizures and leads that don't, there's a sort of differing distribution. You can sort of see the bimodal distribution in both of these, but the distribution varies between the leads. And sure enough, if we apply a linear mix model, taking leads as a random effect and then looking at the involvement of seizures as the fixed effect, there is a significant effect in both of these, where both of these differ depending on whether or not there's epilepsy occurring in that lead. Looking at it over time, this tells us a bit more about the dynamics. Now, at the top of this page, we've got the aperiodic exponent, then underneath that, the aperiodic offset. And what we see in the lead up to the seizure is this slightly paradoxical increase in the aperiodic exponent. So just a reminder, the exponent, if that goes down, that seems more excitatory. So it's rather surprising that goes up just before a seizure. and then it seems to come back down after the seizure and potentially overcorrects a little bit. On the side of the offset, there's a clear difference between the two groups, the population of leads with epileptic changes and those without, and that's persistent before and after the seizure. During the seizure, what we saw was this, where at the start, the aperiodic exponent starts to dip, and this would be associated with greater excitatory firing according to that model. It then levels off and starts to swing back to becoming less excitatory. The offset, on the other hand, seems to stay flat, and then about the same time that the exponent starts to uptick, it starts to increase as well. So in its own way, becoming a bit more excitatory. There's slightly interesting dynamics there. After I'd already submitted an application to present here, this preprint came out looking at the same thing. And so they've looked at the aperiodic exponents and lead up to seizures over a slightly grander timescale. But again, they show this slightly paradoxical increase in the exponents and lead up to the seizures. So it's reassuring that we're seeing the same thing. But what's weird about this, what was weird to me, was they're changing over the same scale, but in different ways. And so I sort of wanted to see what the dynamics were of how they interacted with each other. And so I plotted them against each other in a quiver plot. So in this one, we've got an XY grid of exponent on the x-axis and offset on the y-axis. And the arrows show the sort of time step change at each point on that grid, averaged for all samples. It's noisier at the edges because there's fewer samples there. If this was completely centripetal and just pointed to the middle, it would be uninteresting because that would probably suggest that really it's just a noisy system that kind of self-corrects. But I don't know if I can convince you, but to me, there was quite a clear kind of swirling pattern to it. It was a bit orbital, as well as this sort of slightly triangular area of less velocity and therefore more stability. And also, if I split it up between leads which were involved in seizures and the leads which weren't, the dynamics appeared different. And in the leads which weren't involved in seizure, the peripheral velocity seemed higher, like it was being pushed towards that center more strongly. But to understand this, I tried to parameterize it. So I think Tim touched on this, but when I show this to my clinical colleagues, I'm not going to be allowed to use an equation, but I feel like I can here. But here I've taken some inspiration from fluid dynamics. So where I studied medicine, I studied physics, and I really liked chaos theory. And this reminded me a bit of fluid dynamics. So I've borrowed some stuff from the Lorentz attractor. But the x in this is the aperiodic exponent, the y is the offset. Looking at these parameters, we can think of P1 and P0 as these independent drifts, potentially relating to an external pressure driving this activity. P2 and P8, these are the kind of self-correcting or self-affecting linear terms. So how does the aperiodic exponent act on itself? And then the P4 and P9, these are the quadratic equivalents of that. So things probably kick in slightly further away from 0. Then these terms are where it gets a bit interesting because these are the linear interactions. So P3 and P7 are the linear interactions between the two terms. And then the XY terms, these are the ones which we'd expect to give the kind of circularity, the swirling nature to it. I fit the data using SPM's Gauss normal optimization function, and I fitted different epochs. Here we can see the pre-ictal, ictal, and post-ictal windows. We'll just go through how these things kind of changed. So I've just selected some slightly arbitrary terms which I found interesting here. But if we look at, say, P1, so that's the one which is like an external pressure on the behavior of the exponent in this data. When that's lower, that's more excitatory. So the external pressure is telling it to be more excitatory. And when we go into the seizure, its approach is 0. So that sort of makes sense because if you were a brain, a bit of you was seizing, you'd encourage it less. You'd have less excitatory drive applied to that. And then after the seizure, it seems to return to baseline. I also split the data and parameterize according to the involvement in the seizure or not being involved in the seizure. And here again, we see some interesting differences. One which is particularly interesting is the P2. So P2 is the intrinsic self-regulation of the exponent. This changes sign between involvement in the seizure and not involvement in the seizure. So in your seizure uninvolved areas, it's a negative feedback loop where if it gets too out of control, it should self-correct. But in the epileptic regions, it's not. Could be a vicious cycle. It's a positive feedback loop. And also P7, when higher, there's more sort of intrinsic trade-off, because that's the trade-off between the exponent and the offset. And when that's more positive, that means that as exponent dips, the offset, or the excitatory aspect of the exponent dips, the offset sort of overcorrects and would become more excitatory and overtake that. So it's all very well saying that the parameters fit nicely. I also just wanted to make sure that there were differences between these vector maps. And so I applied a sort of voxel-wise analysis with SPM. So on the first level, I applied a GLM for a given arrow, taking the independent variables of the lead, the participant, it was very hierarchical data, and whether or not they're involved in seizures. And then for the dependent variables, I took scalar quantities, which estimated the dynamics at a given vector. So speed, acceleration, and then curl and divergence. So I guess they're not quite scalar, but curl is how swirly it is, and divergence is how much there is spreading out for that given point. And just focusing on curl, for example. So this is comparing the curl of the leads which are involved and leads which are not involved. And the red areas are the ones where there's a significant difference. So it's clear there's a reasonably big difference between the vector fields as explained by seizure involvement. So in summary, aperiodic parameters differ between seizure involved and seizure uninvolved leads. Aperiodic dynamics differ between the different states and also different regions. Modeling the dynamics can sort of help pick apart extrinsic versus intrinsic factors potentially, but also the dynamics are complex and the values must be considered together. So there's more publications coming out using aperiodic parameterization, but they're typically just focusing on one at a time. And I think there's some subtlety that's lost about how they talk to each other. So future direction, one of my regrets is not including the knee, which is another potential parameterization, which would put things into 3D, and then potentially we can see more sort of chaotic behavior. The other thing is I only fit one model, and I really should have tried a couple and done some Bayesian model selection. So that's my next job. But I think what's exciting is we can build potentially physiological models. So I'm collecting data with lots of anticonvulsant medication prescription information, so we can see how those drugs affect this aperiodic behavior. And the other thing is, from a translational aspect, if we were to include aperiodic parameterization in feature selection, it would be quite a useful tool that a machine learning algorithm could potentially apply to examine its data. Thank you very much.